The Tallahassee Memorial Heart and Vascular Center is a leader in the Southeast when it comes to advanced heart care. And as the center grows, so do the options for their patients when it comes to treatment and diagnostics. Here to explain are Dr. Batchelor and Dr. Kerala. Thank you so much for your time. So Dr. Batchelor, I understand that TMH was the third hospital in the country to commercially offer a new procedure. What is this procedure?
It's called the WATCHMAN procedure. It's a procedure that allows us to treat patients who have atrial fibrillation with an intervention that helps to prevent clots from forming in their heart and causing strokes and other complications.
So Dr. Kerala, will you just briefly explain then how this WATCHMAN works?
The procedure involves putting a device that essentially acts as a plug in an area of the heart called the left atrial appendage, which is the structure essentially responsible for clot formation and stroke in patients with atrial fibrillation. So over time, this plug prevents clot formation and prevents stroke. At the same time, allows us to stop patients from taking blood thinners, thus reducing the risk of bleeding.
All right, then, so from your perspective, how do you see this milestone affecting the center?
Well, I think this really helps us stand out as a center that's advanced in this technology and allows this technology to be delivered to patients safely. There are not a lot of centers that were selected to roll out this technology. We were the third in the country. There are over 1,700 hospitals who are jockeying for the position of offering this therapy to patients, and the selection process was pretty rigorous. So we're very excited that we were selected as a site to roll out this therapy, and we think that it's going to potentially be advantageous to a lot of patients.
Now, in addition to WATCHMAN, there are other advanced treatments available. What are one or two that you're really excited about?
Well, cardiovascular care essentially involves taking care of blood clots. And this can happen in the veins and in the lungs. And one of the new modalities is a new procedure called the EKOS procedure to take care of blood clots in the lungs or in the veins using a special ultrasound catheter.
EKOS is a technology which combines ultrasound pulse waves and infusion of a blood thinner medication to treat blood clots. This is typically used when a clot has gone from the leg to the lung, called a pulmonary embolism, and has lodged in the vessels in the lungs. The procedure is fairly straightforward. We put IVs in the groin, and using X-ray we advance catheters up to the vessels in the lung where the clot is located and place the catheters directly in the clot.
Up until now, when patients came in with blood clots in the lungs, all we could do was give them a blood thinner in a vein and wait for the body to dissolve the blood clot. But now we can put the catheter into the lung arteries themselves and infuse a clot-busting drug and dissolve the blood clot in a matter of hours.
In addition to the many advanced treatments available, there's also been great improvement in diagnostics. Here are two leaders in cardiac imaging.
Cardiac disease continues to be a large cause of death and disability in our country. Cardiac imaging is used to diagnose and manage patients with cardiac disease. The current modalities that we use include echocardiography and nuclear stress imaging, which are non-invasive imaging tests that we can use to look at the function of the heart and look at the blood flow of the heart.
Over the last several years, we have been able to adopt more advanced technologies to image the arteries of the heart non-invasively. This makes it more convenient for the patient to know whether they have heart disease or not. Our CT technology allows us to beautifully look at the arteries of the heart with minimal radiation exposure to the patient.
Complementary test to cardiac CT is cardiac MRI, which we now have at TMH as well. This allows us to get an up-close and personal view of the heart, not the arteries like CT does, like Dr. Guy was talking about, but at the actual heart muscle and the function of the heart.
With the advances in technology that we've seen here as part of Tallahassee Memorial Hospital, we're now able to detect heart disease at a very early stage. This allows us to get people on the right medication earlier in life to prevent future heart attacks and strokes. It also allows us to get people out of the emergency room in a lot faster time, as we can now rule them out for having heart disease in a much more expedient manner.